It's a great pleasure for the United Nations Population Fund, UNFPA, and myself as the director of the Geneva office, to partner with the World Council of Churches, UNICEF, and UNHCR on this high-level conference, and to join you in this session to reflect on what is at stake and what we all can contribute to responding to the largest movement of displaced people through European borders since World War II. What are some of the essential ingredients to meeting the unprecedented challenges for all of us in 2016? And how can we ensure a coordinated response, which is, as Dr. Aboum said in her introduction, based on human dignity, human rights, and human democracy? And also a coordinated response that will allow the young Syrian girl that we just saw in the UNICEF video to overcome her pain and to live a full and realized life. UNFPA, during this introductory session, has been invited to provide some key findings from our recently launched State of the World Population Report. Some copies will be outside during the break. And we wanted to give you a few of the general findings which are relevant to the deliberations on the refugee crisis in Europe. Although some of the comments that I will be making are at more of a general level, I'm also pleased to tell you that my colleagues present here from the Eastern Europe and Central Asia region, as well as the Arab States Regional Office, will share specific examples of our work on the refugee crisis in Europe, as well as our partnering with diverse religious institutions and NGOs, and actively supporting the coordination of efforts around humanitarian relief to migrants and refugees in Europe. In the tumultuous early phase of a crisis, food, shelter, and care for acute physical trauma often seem the most compelling needs. With gender or any other kind of discrimination, something that can be put off for a safer day. Thinking this way, however, can make a response blind to realities on the ground, including those that shut women and girls off from assistance or even leave them vulnerable to violence. These are some of the key findings of UNFPA's State of the World Population Report 2015, Shelter from the Storm, a transformative agenda for women and girls in a crisis-prone world. And they are the key messages that I wish to underline here in your distinguished presence today. That is, that when a crisis strikes, women and girls are disproportionately disadvantaged and often less prepared or empowered to survive or recover. Our report shows that of more than 100 million people in need of humanitarian assistance in 2015, an estimated 1/4 were women and adolescent girls of reproductive age. As we all know, pregnancy waits for no one, not war zones or political negotiations, not hurricanes nor epidemics. Jean-Claude has spoken about the needs of children, and he's reminded us that 42% of the arrivals in Europe by sea in 2015 were women and children. Among the IDPs across Ukraine, for example, many are women of reproductive age, including thousands who are pregnant. Overall estimates from the Balkans transit route between Greece and Northern Europe indicate that many require basic reproductive health care, including obstetric care for those who are pregnant. An estimated 4,200 of the total number of women entering the Balkans route between the fall of 2015 and the spring of 2016 are likely to be pregnant, and another 1,400 are likely to be at risk of sexual violence. Turning to the global level, every day 507 women and adolescent girls die from complications of childbirth in humanitarian settings. In fact, the report highlights that 60% of preventable maternal mortality is taking place in humanitarian and fragile contexts. A lack of even basic sexual and reproductive health services makes giving birth in crisis settings a potentially deadly proposition. Multiple international standards define health rights, even in humanitarian crisis. Emergency obstetric care, essential newborn care, access to contraceptives, and clinical management of rape. And yet, these interventions remain among the most poorly funded and poorly provided components of humanitarian response. We also know that gender-based discrimination survives even the worst humanitarian settings. social norms continue to play out, impeding access to essential services. And without the usual protection of family and community, women and adolescent girls frequently become victims of sexual violence, unwanted pregnancies, and sexually transmitted diseases. Adolescent girls in particular fall through the gap in humanitarian response, and more than 2/3 of the projects to protect sexual and reproductive health and rights of adolescents in crisis have gone totally unfunded. No matter what the circumstance, we must recognize that an adolescent girl deserves protection from unwanted sex, that child marriage is always a violation of human rights, that each adolescent, as they make their passage from childhood to adulthood, has the right to information and support. During and after any kind of crisis, gender-based violence may soar, including in its use as a weapon of war. Moreover, extreme financial hardships stemming from disaster or conflict can lead women to transactional sex or make them vulnerable to trafficking, and we are already seeing this in the context of the refugee crisis in Europe. Gender-based violence violates international law and principles of gender equality, and protection from further vulnerability and harm is a central responsibility of humanitarian action. What our State of the World Population Report is saying then is that interventions that fail to account for the different ways disasters and conflicts can affect different groups can end up perpetuating inequalities, such as when general health care is provided in a crisis, but not services related to pregnancy, childbirth, or contraception, leaving already disadvantaged women and girls in an even more precarious situation. Given the scale of the crisis in the world today, including in Europe, it is time to transform the conventional approach into one that takes account of diversity in crisis-affected populations and wields that diversity for the benefit of reduced risk, faster recovery, and greater resilience. As the concept note for this high-level meeting urges, there is a critical and urgent need for coordinated collective responses to the migration crisis, which must be underpinned by universal principles of international, humanitarian, human rights, and refugee law, and based on the eight-point agenda for action presented to the UNGA's 2013 High-Level Dialogue on International Migration and Development. UNFPA's role is to ensure that women and adolescent girls have access to sexual and reproductive health, including safe delivery and other services, no matter the circumstances. As a strategic priority, we are committed to scaling up the gender-based violence area of responsibility, co-led together with UNICEF, as part of the Global Protection Cluster. UNFPA has a specific role to coordinate prevention and response of gender-based violence in emergencies and to support national authorities and local communities to uphold the dignity and rights of all affected persons and connect survivors and those who are most at risk, especially women and girls, with multi-sectoral services. Distinguished participants, esteemed partners, the stark reality is that women do not stop getting pregnant, menstruating, or delivering babies when crisis hits, or when they have to flee their homes and undertake arduous and dangerous journeys seeking refuge. During her tenure as Special Representative of the Secretary General for Disaster Risk Reduction, today's Swedish Minister of Foreign Affairs, Ms. Margareta Wallström, said it very clearly, and I quote, "It is a plain and simple truth that disasters reinforce, perpetuate, and increase gender inequality, making bad situations for women worse. Therefore, attending to sexual and reproductive health, including gender-based violence, in countries of migrant origin, in countries where they pass through, and in host countries, has to be moved to the center of humanitarian action and become a clear priority in coordinated service delivery. Not only is it more widely accepted that meeting all basic needs of migrants is a humanitarian imperative and a matter of upholding and respecting human rights, but it is also clear that ensuring access to sexual and reproductive health is a pathway to recovery, risk reduction, and resilience. The concept upheld by our faith-based partners to this consultation reminds us that migrants require effective mobilization of all available material and human, as well as moral resources and values. In UNFPA, there's not only a commitment but indeed a legacy of culturally sensitive responses and approaches to development and humanitarian work, the very spectrum on which refugees are also to be found, which requires engagement of religious leaders, institutions, and faith-based service providers. Yet while we began the engagement with these critical actors in the 1970s, and we acknowledge that many of your organizations are such long-term partners, we also acknowledge that we can do more to engage more systematically and coordinate more strategically. We therefore look forward to our shared deliberations, the highlights of successful practices of coordination that bear scaling up, and to the concrete recommendations over the next 2 days to deliver on the urgent and irreversible needs in these trying times. I thank the World Council of Churches again for organizing this meeting, and I wish us all inspiration and guidance in lieu of simple good luck, for we are all in need of these. I thank you.